So
Hi.
would you like to introduce yourself?
Yes. Hi, my name is Karen, and I started coming here a week ago for treatment. Um, I've come before for Bible studies here, and so between the two is where I get my healing and strength. A week ago, I had severe pain in my left arm. It just started overnight, but it was very severe. And a year ago, I was diagnosed with polymyalgia rheumatica, and the pain was in the same arm and severe, so I assumed that it was coming back and called the radiologist, but I couldn't get in for 4 days. My primary doctor was gone. She wasn't coming back for 4 days. And so they did let me see another doctor, but she just prescribed stronger pain pills. And they made me nauseated and so woozy that it was too much. And so I stopped taking them, but the pain was so severe, so I made an appointment to come in and see Dr. Jerry and Dr. Rich. And before that, I had had x-rays taken and I had an MRI, and so I had them send the report over here, and they started treating me. Dr. Lala adjusted me, and Dr. Jensen started acupuncture, and it was almost instant relief, and I felt so blessed. I have been coming back to keep the treatments going, but I am so much better. I don't have the pain, and I can walk better, and it's just a miracle. I thank Jerry and Rich very much, and also my God. I believe in healing, the power of faith healing, and I'm receiving that.
So how many times have you been to see us now?
I believe this is the fourth or fifth time.
I believe you're correct. And after the first treatment, what did you find different?
The pain. It relieved the pain.
Was it 100%? Was it 80, 50?
I think it was close to 80% right away. And the next day, especially, I didn't have pain anywhere. And so that convinced me.
That's wonderful.
Yeah.
So you said that it was down about, it relieved about 80%.
Yeah.
And the pain had before been keeping you awake.
Right, it was constant. It was a throbbing type pain. It just never let up all day or all night. And I couldn't sleep. I couldn't get comfortable. I didn't know what to do with my arm because it hurt so bad. So I basically walked the floor.
And you were able to sleep through the night, that first night?
Yes.
And since then, you've been able to sleep through the night?
Right.
Excellent. Some people underneath that much distress, they usually, their blood pressure goes up. What was your blood pressure?
Was 2/70 over 190 something.
What was it? It was 270 over
Yeah.
over 190?
Yeah.
Okay. Okay, and are you on blood pressure medication?
Yes, I am. But the treatment that I received along with the medication, I believe has brought it down. But I think that the treatment has really helped.
And what was it today?
116 over, I believe, 68.
116 over 68.
Yeah.
That's a significant drop.
Yes, it is.
And I mean, you're actually smiling now.
Yes.
And did we give you things to do at home to help your care?
Yes, neck exercises and for my back, and I've been doing them. And my neck is free. I can turn from side to side, and I don't have any pain. And I just feel good.
Are we free to share what some of our findings were on the x-ray?
Yes.
Okay, so we found that you had, I believe it was 3 collapsed vertebrae
Yes.
in your thoracic spine along where the pain was.
Right.
And also we found on the MRIs that there was stenosis or a pinching of the nerve.
Right.
1 was severe and 2 are moderate.
Right.
So these are things where you have physical things that would create pain.
Yes.
And
very
how much pain are you in right now?
Well, none right now.
None. Without medication?
Right.
And
No
when you
medication.
were on the strong medication, the strong pain medication,
Mm-hmm.
you said what did that do?
Well, it just made me so woozy. I couldn't function.
And did it relieve all the pain?
No. No.
70%?
Yeah, I say that's reasonable.
It
Right.
cut it by 70%, but you
Yeah.
had the side effects.
Right.
Okay. Okay.
So,
Anything else to share at this point?
no, I'm just happy I'm here. And when I left, I saw my primary doctor today. And when I left, she said to me, if I'm ever in pain, she says, I'm going to see your chiropractor. She said there was nothing I could do for you anymore, she said. And so she was very pleased.
Wonderful,
Yeah.
wonderful. So what would you say to somebody who's considering coming to this clinic?
Oh, please do. The treatment and the friendship and how everything blended together, I said, I would recommend you to come. It's remarkable how much I've been relieved in just the 4 days. So.
That is fantastic. That's fantastic. Can we, Dr. Lala and myself, share this video with other patients, doctors, students, and the general public everywhere?
You sure can.
Any restrictions on that?
No.
Thank you very much.
You're welcome.